Nothing to do with that. Okay, let's see.
Oh, hey.
All right, everybody, sorry for the strange delay. YouTube was not wanting me to start my session, I guess. So we'll wait a few minutes for the other people to come in. Can everybody hear me? Should be able to type a comment if you can. Okay. You're welcome. Okay. We have about 10 people watching. All right, so might as well just get started. This is going to save, so you can always refer back to this at a later time if you want to, and anybody can also watch this at a later time as well. So first thing, what we're going to be talking about is sort of your expectations, the time and the work that you put into on rotations, and what that work should kind of come out as far as your learning. When would the other videos be out? So we're going to set apart separate times to ask questions. So just think of your questions and then ask them when I ask you guys to ask them. So we'll just go over a few things first, and then I'll give you that time. So for expectations, the student's role in the hospital obviously is a little bit more advanced than it was when you're in Grenada on the island, or if you had done this earlier on a shadowing rotation or something like that. So it's usually not in the aspect of you shadowing, but you're actually doing something. You're seeing patients in the morning, you're checking up on all their labs that they came in the morning and stuff like that, getting the whole picture, and then you're going to be presenting to either a resident, a fellow, or an attending physician on the rounds. That usually is how most rotations will go. If you're in the clinic aspect, like family medicine or OB, you usually will be let into the room first to interview the patient, see why they're there, give them any reports of if they've had lab work, kind of tell them about that, and you do any physical exam on the patient to see how they are. And then you come back and you present all of that to the attending within a minute of you finishing all that stuff. So that's sort of what your daily role is. So the objective sort of what you are doing is to make sure that the team that you're joining and a part of are still functional. Obviously, we don't know everything clinically. We're still learning that stuff. And so we kind of slow down the process throughout the day. So your goal is to learn how to get it back up to pace, if not make it faster. And that includes doing random small things like getting computers for the doctors to look up information if they don't have portable ones or iPads or something like that. Whatever it may be, getting information from other hospitals, getting stuff faxed over, calling the lab for different things, whatever you can do to make the small work get done so that the residents can be having their mind full of how to treat patients. And so they don't have to worry about doing and spending so much time on those little things. So that's something that we can do as students to help out. Sort of scut work in some places, but other things are actually kind of helpful and help you actually present information better. So imagine if you're waiting for a lab result, a particular one from one of the Quest locations or something like that. If you were to actually do that little bit of work and call them and get those results, you'd be able to tell the attending physician and the residents when you're presenting that case on rounds, and it actually helps you. It actually helps you put a better picture and helps your explanation of what you think differentials as far as what the patient has. All those things are helpful to you and to the team. So that's sort of the objective of what you do as far as the flow of every day. But the most important thing as students is to learn, right? So we're paying $1,800 a week or almost that to learn. And if you're not doing that, then you're wasting your time and you're having your time wasted by doing random things. So always be prepared to ask questions, to ask the thought process behind questions, because you're not going to always get that. Rotations such as surgery, rarely will you find a surgical rotation where all the residents and all the doctors will explain why they're doing something. They just expect you to look at it and not say anything. And hopefully you know why we did that procedure, why we did these little techniques and stuff. So it's really your time to shine in asking questions of why we did things. And that comes down to the medicine floor as well. What are you going to do when you have a certain type of management for diabetes, or for this guy's lower limb amputation, but he also has some comorbidities, right? So like, how are we dealing with all those individual things, and why are we dealing with them in that way? So asking those sorts of questions is going to help you learn. And then also try to ask your questions gauged around what you're studying. So we'll talk about that on the individual rotations, kind of like how, what to study, when to study it, like what stuff should you put early in the rotation to study so that helps you on the floors. We'll talk about all that. But as far as your learning, make sure you're asking questions of information that you're supposed to be learning. Things like dosages, you don't really need to know that until you get to, like, step 3 sort of stuff. So if you have a resident or something telling you to learn dosages of different drugs, that's really not going to help you. It's cool, you can waste that brain space right now, but it's really not going to help you for this current time and even up through your CK exam. You don't really need to know that. It's just, do you need to know why I'm using this certain medication? Maybe sometimes there's like high versus moderate dosage and stuff like that. That's a general concept that can be learned, like antibiotics versus like statins and stuff like that. They have those general base concepts in between there. That's what you should know, but you shouldn't need to know super details like at a resident level. So make sure when you're asking questions and what you're learning is at your level, and you'll know that because it's pretty much, imagine all the questions you did on step 1 that were management. Everything you studied for step 1, that was management, like farm, pretty much. That is step 2. And if you can think of every single vignette question you had on UWorld or for step 1 that start off with a history and a physical exam, right? And if you stopped right there, that's your step 2 questions, and take away the lab test and the imaging, because that's what step 2 CK questions are. They ask you what is that next step that you would do for diagnosis, or once you diagnosed it, what's the next step in management, right? It's all those last sentences of your step 1 steps. So that's also a great way to actually learn, and we'll talk about this later. If you're doing tutoring on the side of your rotations, that is a great way that while you're teaching and going over questions with your students, that you can take their stems and actually help you learn as well, right? Test yourself when you're practicing and going over their questions to explain it to them. You can stop to think, can you think of what the next thing would you do? And hopefully that's going to help your studying for your shelves for your exams, as well as for your step 2 CK. Another thing for expectations and the time. So time management is super important because some rotations are super long schedules, like surgery, insane. Like really early morning, sometimes you're waking up at 4 o'clock in the morning, going in and doing a bunch of random stuff, seeing your patients, and then they start rounding at like 5:30 or 6 o'clock. You're seeing a bunch of patients, and then you start going to the OR at 7 o'clock. And that's actually why surgery does that, because their OR schedule starts at 7, so they want to get rounds and everything done before. And then you can stay there all the way through the OR day, and that's sometimes 7, 8 o'clock. And so studying, it makes studying really hard. Trying to learn all this stuff when you have an hour to study before it's time to go to bed because you're trying to get 7 or 8 hours of sleep. So time management is super important, not only on day-to-day thing, but also week to week and month to month. If you have a 12-week rotation, for example, like surgery, it's important to kind of map out a basic goal, objective schedule for what you want to study. And what you're estimated to try to push yourself to be able to study within those time frames. So make sure that you start that on the very first day of your rotation, what you expect to start studying over the course of the few weeks. It'll take you a little bit to get back into it if you took a nice break after step 1 before you start rotations, but it'll start to move faster and faster and faster, and you'll get better at it. So that's one thing that I would suggest, is to start your time management and kind of baseline, bare bones schedule objectives that you want to do for each rotation, and start that usually on the first day. Expectations as far as differing between hospitals. So I know that when I say expectations of what my hospital says, I'm telling you from my experience in Stockton, California, where people have rotations in New York and New Jersey, where it's like super busy no matter what rotation all the time. There are different expectations of how much time is spent at work, and like what you can do and what you can't do, like procedure-wise, getting people's IVs placed and stuff like that. Usually most hospitals, you can do all of that as long as you ask. Usually the nurses do it themselves, but you can ask them, hey, can you walk me through? Can I get some practice with my IVs, getting ABGs, drawing labs, getting blood cultures, all those things you're allowed to in pretty much most hospitals, to go and gather all those things, get your practice with your hands-on skills sort of stuff. So that's usually across the board, but as far as expectations of length of stay, that differs. So some hospitals, like in Miami, for the adult medicine sort of stuff, is super chill, and surgery is like every other week in Larkin, I think it's the hospital. Or New York, New Jersey, it's like every week, sometimes like lots of weekends, and it's super busy. So it does differ on the amount of time you spend every day and throughout the week on your rotation. So you have to kind of adjust your schedule accordingly. So anticipate that, get a heads up from anybody that you know at the hospital before, just so you can start to prepare yourself for how much weight your time at work schedule is versus your time at studying. So that's something just to anticipate coming. But as far as the day-to-day, everything that I've said pretty much applies. You're trying to make this team work smoother and faster, so you got to do some of the small bits of work so you can make everything easier. And if you do that, it actually allows them to release you earlier in the day if you do all the follow-ups in the afternoon as quickly as possible. So sometimes, that little bits of push work do get you a better day so you can go and study. So that's important. But while you're there, you're spending time, you're stuck, might as well learn to help you for your shelf exams, and try to correlate it with what you're studying if you can. Some rotations, it's harder to do that because there's so much information. Like IM, there's a couple things, like 2 sections we'll talk about that you can study first, but you're not going to cover all of IM in the first week and be prepared every week because you've studied everything. But yeah, so if there's any questions as far as that, I'll spend like 2 minutes waiting for those. So go ahead and ask your questions if you have any. So I guess I'll ask this Araya as well. His is up there already. When would the other videos be out? Do you mean the recording of this session currently be released? All right, I guess nobody has any questions. Okay, so the next section we're going to kind of talk about is internal medicine. So I'm actually going to type this in the comments. So first, I want to talk about resources that you can use to study for internal medicine. Internal medicine is very busy, and there's lots of learning, and it's pretty much next step in management, next step in diagnosis of everything that you have studied for step one, including biostats and epidemiology, including your behavioral sciences and what you say as a doctor. Those are all the things that that you will be studying for internal medicine. So the first thing that I want to talk about is how you manage learning in internal medicine. It's very important to know reading resources, organizing resources, question resources, and if there's any video resources, what those may be and how the sequence of doing it. So I'm going to explain kind of a great way to do it is the way that I did it, and a lot of students find it very helpful to follow this kind of format on how you study. It actually helps them to perform better on their UWorld and understand kind of the material and how to answer questions for your shelf as well. So what I usually do, and I'm typing up these resources right now, is I always use a question bank. You're required to do a Firecracker resource, kind of read the things each week. They give you a chunk of things to read each week, Monday through Friday. Then you have a quiz at the end of each week, which is like 20 questions. They're very nice questions to practice with, test your knowledge at that point in time from what you read in the previous week. And then at the end of the rotation, you'll have an exam. It's like 100 questions from each kind of like shelf for each rotation. You'll have an exam to help prepare you and give you some just practice questions. So this is what I would recommend for internal medicine as far as resources. First, you should have a reading resource. This is kind of the base knowledge stuff you start reading from. And my suggestions are either the book Step Up to Medicine, which is okay, it's pretty good. Not everything's in there. Not everything is in one resource, just a fair warning. So Step Up to Medicine is a pretty good resource. It's pretty organized. It's got it in the different sections, body systems that you'll cover for your internal medicine. Alternate to that is your IM Essentials, and this is on the actual ACP, American College of Physicians website. You just type in IM Essentials ACP on Google. It costs about $40. It includes a text, and it includes really good questions for each section as well. They're quite a bit harder than the UWorld, but they test your strength and knowledge, and they can give you some great insight explanations of why answers are correct, incorrect, and so you don't fall for any of the hard tricked questions. So that's something that I would recommend. I actually used that. I found it a great resource. It pretty much broke down the different sections of each body system. So cardiovascular, for example, there's chest pain, that's its own thing, and it breaks down the different types of chest pain, how to diagnose the different types of chest pain, how to treat the different types of chest pain, and then follow-ups for any of the cardiovascular related chest pains. They have different things like arrhythmias. So they talk about it. They talk about preventing, screening, diagnosis, therapy, and then follow-ups. I would always emphasize the follow-ups is a great question that shows up on your shelves. Super high yield to know your follow-ups for your diseases. It's sort of like the complications and risk factors that you had on step 1 for diseases. Now you're talking about more management, diagnosis, screening, therapy sort of stuff. And follow-up is a very important thing. If there's any follow-up, that's super high yield to know for major diseases. So a reading resource is really great. This one has both book, text, and it has questions. So I would recommend it. It's only like 40 bucks, 40, 50 bucks, something like that. I used it. It was great. It kept me organized on my reading material. Then the second thing that I would recommend is obviously doing your Firecracker. You can kind of sprinkle that on your rotation throughout the day whenever you have a break. Just get the app on your phone and just read the things, kind of scroll through it, and that's helpful just to get random information given. And so that's helpful. And then you'll have the quiz each week. And then online med-ed. I'm sure you guys have heard of online med-ed. If you haven't, online med-ed. It's free to sign up for an account and to get access to all the videos. There are some files floating out there that go along with the videos. So get your hands on those guys. It's nice to have that like kind of paper right there. You can highlight, draw the diagrams and everything that he's drawing. It's all right there. So you don't have to like waste so much time copying down everything he's writing. Keeps everything organized, and he's really great at applying not only where questions come up, sort of like the pathoma of all of year 3, but he's also very helpful in explaining how you apply this towards the wards as well, and how you explain this to an attending physician if he asks that question, how it applies to your treatment and management of the patient on the floor, those sorts of things. He does cover those in his videos and his documents as well. So look to find that resource. So reading resource, then a video resource with documents. Those are the two baselines of heavy knowledge. The Firecracker adds supplemental in there. Then the third thing is you need something to take all that chunk of information and convert it in your brain to a format of sort of like questions. Okay, so yes, UWorld is that thing, but you also don't want to cry when you first go and dive into your UWorld. You want to at least feel like a little bit comfortable and feel that you can cover some of the weird diseases that weren't in the reading resources. And this is the third resource I use. And I typed that there. It's called Memoring. You just Google memoring.com. And this is a great application. It's free to sign up for an account, but to purchase, and I would highly recommend this. Purchase. If you click up on the top, there's a big red button that says Power Ups, and you click on that. And under there, there's a Step to CK flashcards created from med school tutors. It kind of goes over everything very organized. They're flashcard based. So if you like Anki stuff, you're going to really like to actually do them like flashcards. But I never use them as flashcards. I use them as sort of a reading resource. And what I mean by that is there's a nice little vignette on the front side of the flashcard. Sometimes there's a picture with it, like say dermatology. There's a nice picture of the lesion, and then it talks about a 75-year-old Caucasian male, whatever symptoms, presentation, how he describes it. And then that's it. That's the front of the flashcard. And then on the back side of the flashcard breaks down different pieces, and they're organized. It's what is the diagnosis? What is the etiology? What is the pathophysiology? What are risk factors of this? What is the next step in diagnosis, which for this one would be like biopsy or something. And then what would be your treatments? And then if there's a follow-up, sometimes they're in there. So it breaks it down very organized. So you've had this reading resource, right? Like either IM Essentials or Step Up to Medicine. Then you have online med-ed that makes it stick better in your brain. And then you get those all together and you organize them with Memoring. And it's very quick. You can just scroll through a whole bunch of these sections quite fast. Just read the little vignettes, go down the little things. You know, it's very organized in your brain. Then you attempt your UWorld. This is where, with this stepwise process, then your UWorld. I did not use Memoring when I first started internal medicine for the first like 3 or 4 weeks. And I was struggling on UWorld, getting like really low percentage blocks. When I was like, I need something to organize this in the brain because there's a lot of information. It's kind of just It's good, but it's not super organized. When I did my memorying, it went up 20% like that instantly. So do your memorying. That's a great and helpful tip to do right before your UWorld, and then you do your UWorld. I think that is one of the best things. Then the last week before your shelf, that's where you throw in your NBMEs. As you know, every rotation has those. But that's how you would undergo internal medicine as far as how you use your resources. And that's my recommendation. And a lot of students I've told to follow this, I go into IM and they loved it. They love that flow, that direction, and they love that memory organization. So that's my recommendation for that. So you can do whatever you want with these resources. That's all up to you, but that would be my recommendation. Now, next would be what to study. All right, I have my resources, but now what? For internal medicine, because when you're on the floors, you should at least be decently knowledgeable of the basic things that you see on the floor. And those three things are, number one, endocrine, diabetes, right? Everybody's got diabetes. Second thing is infectious disease, which is like the vast majority of your internal medicine patients can have some sort of infection. And then the third would be cardiology, heart failure. So I would do them in that order. I would learn your endocrine section. So do all the reading, do your online med ed, and do your memorying and do your UWorld for endocrine first in the first like week or so. I would do infectious disease in like the second week, and then I would do your cardiovascular, which usually takes about a week and a half to 2 weeks. It's a very heavy section. Those are the three that are going to prepare you for the wards. If you start off doing it that direction, you're going to be more prepared than pretty much every other student that just always starts with cardio, and then endocrine and infectious disease are at the end of the rotation. And then they get there and they go, oh, I wish I knew this at the beginning of my rotation. So that's my recommendation. And that's what I did. I had it at the end and went, oh, would have loved to know how to bridge a patient and know what sliding scale is and stuff like that. So those are my three first recommended. After that, you can do whatever, respiratory, renal, heme, GI, whatever. That's up to you for that. But those are the three that you're going to see on the wards all the time. Might as well know something a little bit about it, so you can answer the doctor's questions when you round on those patients, okay? So that's how you would do internal medicine. Resources, follow that path. Online med ed has also a schedule you can kind of follow. They don't have 12-week rotations anywhere except for SU. So it's great. You can just use their 8-1 and then, make it expand over a little bit longer of time. But that's how you study for internal medicine. Next, I'm going to, Cynthia, I will answer your question after I talk about the next thing. So if anyone has any internal medicine questions, go ahead and type those up and I'll answer those after I talk about how to study for CS and CK. We'll come back to the next other rotations in a few minutes, but CS. So CS is pretty much an OSCE exam with 12 encounters, and it's graded on 3 different sections on your communication, your management, and your medical thought process. And then the third is the overall encounter with physical exam, interacting with the patient, showing empathy, all those sorts of things. And that also includes kind of your note in there as well. So those are the 3 sections that your 12 encounters are graded on. 2 of those will be dropped. You don't know which 2 those are. And you got to pass all 3 of those sections that the average of those 12 are combined together about. It's sort of a stressful exam. It takes about 2 to 3 weeks to really sit down and prepare with someone for this exam. I would highly suggest getting the first aid step 2 CS book. This is a very helpful book that goes over with practice cases. It has mini cases to think of differentials when someone comes in with cheap complaints and small bits of history that they give you, and practice time-wise. So practice getting a history and physical exam within 15 minutes and then 10 minutes of note. I would highly recommend practicing on a real keyboard, not a laptop keyboard with the small little keys that you're used to typing really fast on. Go to a big keyboard that makes a lot of sound when you type on it with the big giant keys. That's great practice because when you get to the testing center, your fingers will feel quite a bit more comfortable to do a 10-minute note or even finish it in 7 minutes. And then you have 3 minutes to proofread grammar and all that stuff that you wouldn't have otherwise. So getting the time frame, practicing those things, practicing your physical exam, like full blown, setting apart separate physical exam times. Like, okay, you're going to do the entire body neurological exam, cranial nerves down, go. You have 5 minutes. So practicing those things with somebody is great. And definitely will be helpful. I Skyped with my friend from the UK, Catherine, and we talked about our small cases. We talked about some of the big ones, and then she came and visited me in California, and we kind of broke down the cases and practiced, alternated giving each other cases. And that was great practice. We took our exam together, and we felt quite comfortable being that when we practiced, we felt time pressured, but that's because we were reading this book trying to figure out the answers of the question the history taker was asking us. Do you smoke? Yes, I do. Right? So those are the things that took extra time for me to answer back. But when you're actually in the CS, the person responds like that. So your time actually gets sort of shortened. So practicing, stressing yourself to get it within the 15 and then 10. And when you're practicing with someone, just if you can do that for all your cases, then you're going to have no problem with time on the CS. And then really the big objective is to work on how you communicate English. If you struggle with having an accent or something like that, that's one thing that they actually grade on. So be very careful in how you articulate and explain things to your patients, showing empathy to patients. That's a very important thing, and that always has been for our OSCE exams. So just be thinking of CS as you're going in your rotations and preparing for those. So practice your CS and your skills with your patient when you see them in the morning. So if you're on internal medicine, go and see your patient, show empathy with them, talk about them, or talk to them, and get a history from them. Even if you've read the emergency department note before they were admitted and you read the admission H&P, just go and talk to the patient and get it from themselves, one-on-one with them. Just practicing your thought process of what questions you would like to ask. That's a very good practice. And then in clinic, that's pretty much all CS is going to be like clinic stuff. So think of doing that practice when you're on a clinic rotation as well. So that's kind of my spiel for CS. For CK, so CK is an easier exam than step one. It's pretty much a step one question, deleting, again, the diagnostic test and the lab tests, like imaging and stuff like that, and then asking you about those or what you would do if this lab test came back positive for something. That's a great thing. And then studying for CK is sort of a collection of all of your rotations. And so you'd be doing your UWorld again, you'd be going over maybe the first aid book or some of the other like Kaplan books and stuff like that they go over for your step 2 CK. Make sure you're going over your OME and your reading resources, and even your memorying, which I'm even doing that as well. So that's kind of compiling everything, making the connections between when you're an internal medicine doctor, right? And then if I have an internal medicine question, when would I consult surgery? When would I consult a pediatrician if I had a kid that comes in? When would I consult an OBGYN for a pregnant woman that comes into my service, right? So knowing when you start to consult and connect the dots and when procedures are, right? So if I have someone that comes in with appendicitis, right? There's a medical disease, but the treatment is surgical. I can't do anything. I'm not a surgeon. So I have to actually consult the surgical service. And so I would contact them. So knowing those sorts of things, knowing your emergency versus non-emergency versus ambulatory settings all come up as you're doing your rotations, and making those connections between the services is how you get a well-rounded student to answer a well-rounded exam of CK. So that's what you need to do, is make sure you think of those connections when you're doing each individual rotation and then reviewing them when you're doing your designated for CK. I would recommend about 6 to 10 weeks of designated time to study for CK. Some people need a little bit more. Some people have taken their exam a week after they finish their last rotation of third year. So everybody's kind of different, and also kind of think of what rotations you have last too. So when you get your schedule, think of when you want to schedule your exams. So I have family medicine on that rotation right now. And so family medicine is a summary of everything I have done. And so I'm pretty much starting designated already. So that's something to think about, is what rotation are you on? But if you're in surgery right now, is your last rotation, you should probably have a month after that at least, or maybe 2 months after that before you take your exam. Just because during surgery, you're probably not going to be studying that much, and you can't start your designated recap study during your surgery rotation. So take that into consideration when you're scheduling your exam. Okay, if anyone else has any questions, let me answer Cynthia's. Type those up right now, and I can answer them. So does the school give you a Firecracker? Yes, it does. So when you start your rotations, once you get your score and you submit that to the school, that C Magnifico, Christopher, something like that, Magnifico, he'll reach out to you guys. You're going to reach out to him with your SU email and stuff like that, and they'll get you a login for Firecracker. And then before each rotation, you usually fill out a form that says, hey, I'm starting internal medicine next week, starting on Monday, and you submit that little document form, and it's like a survey sort of thing, and then they will get your course prepared for you. Then when you open it on Monday, you now have this week's worth of material to kind of check off and read through. And you can do questions. One of the cool things with Firecracker is that they have quite a few questions that you can do in there. So once you actually check off, so when you open up a topic, I don't know if you guys have ever used Firecracker before, but if you have a reading topic and you're reading through the page and stuff like that, and up at the top, you have like these little bookmark sort of things. If you click that one and it turns it to like turquoise, and it says turquoise for current, if you click that, it actually marks off, and if there's any questions for that topic, it puts it into a pool of questions for you. And so what you can do is actually go up to the left, and you can hit that study something specific tab. And when you hit that study something specific, there's going to be kind of these columns. One of them is step 2 CK, one is your clerkships. So if you click your clerkship that you're on, so you click your clerkship, find your clerkship. So say you're on psychiatry, you click psychiatry. It pulls up 3 circles right on the screen right there. And the far right one says make questions. And that is your pool of questions you can do out of the topics you've already marked from psychiatry. So what I sort of cheated and did was I went to study something specific, clerkship, and then went through every topic and marked them all current. So then I already have that base pool of questions I can go to right now. So so then I don't have to just wait till I click all of them individually and I get 5 questions every week. It's like, no, I want all of them right now that I can start with. So that's sort of cheating, but just don't tell anybody. But yeah, that's what I do. So you don't have to really always just read random things. That's the thing with the coursework that the school gives us. They go, oh, let's give them topics on Monday, one on cardiovascular system, one on neurological system disease, like super random thing, like B12 deficiency, neurological. And so it's all kind of random stuff. So I don't like that very much. It's not very organized in my brain. So I usually do the study something specific up at the top. And once that opens, I can kind of click on my own material and keep it organized. I can study internal medicine, cardiovascular, and go through all the topics cardiovascular. Then do GI, do all the topics GI. I can study that however I like, and then just do the quizzes on the weekend. That's pretty much the only thing that's required of the quizzes. They say you should do 10 flashcards a day. Sometimes you miss it, that's fine, whatever. But the big thing is really just doing your quizzes each week. Okay, does the order of rotations affect how I should study? For instance, starting with family medicine as opposed to IM. So family medicine, is a summary of everything, but it's mainly a summary of everything on the ambulatory side, right? So it does cover internal medicine stuff because internal medicine is like cardiovascular, all the body systems, everything, like big diseases, heart failure and stuff. But instead of having a severe exacerbated heart failure patient on the floor, what happens when they get better, right? Don't they go and see a cardiologist? Don't they go and see their family primary care doctor to manage their heart failure? Now that's where the questions of family medicine shelf come, is how do I manage heart failure from there, making sure they're on their lisinopril, make sure they're on their beta blockers, those sorts of things. That's where the ambulatory side, that's family medicine stuff. Versus IM is everything, including ambulatory, including some surgical connections, or like when you would consult them, including some OB stuff. So IM is really just everything. IM is pretty much your studying for step 1 again. Pretty much, except it's a little bit easier. It's newer, but it's a little bit easier as far as you kind of know how to diagnose a disease already. So all those questions that are like, what's the diagnosis? You should pretty much get like 90% or greater on all the questions that were like, what's the diagnosis of this stent? Those are easy, but management, next step in diagnosis, those are where the ones that get everybody. So yeah, as far as the order of your rotations, it does affect kind of what you're studying, but to be honest, you should be just studying that rotation, and then when you get to the rotation, you take your shelf. Don't forget that information, okay? This is not like year 1 and you just did 3 weeks of studying, you took your exam, and then 3 more weeks, and then took your exam, and you just delete the stuff. Don't do that. If you found yourself doing that in year 1, you probably have recognized that when you hit year 2 and you were studying for step 1, that it's like, dang it, why did I delete that after the exam? Don't do that, okay? Keep it in there, force yourself, repeat it, refresh on it. But if you're getting close to your CK time at the end of your 3rd year, then yes, like I was saying, just be careful on what your last rotations are on the weight of time that you're allowing after that rotation for designated, okay? If it's surgery, you're not gonna do any designated during it, but if it's family medicine, yeah, you can do quite a bit. And the review of everything for your exam for CK is actually reviewing everything for your family medicine shelf. So that you can actually start your designated at the beginning of family medicine if that's your last one, go all the way through, and then just do a few more weeks after. And then you'll be ready for your CK exam. So yeah, any other questions, please ask. We got about 25 minutes. If not less. Okay, I don't see any other questions popping up. So we'll quickly go through the remaining things. I don't have too much to say about personal statements or CVs. I do have a few about other rotations and then letters of recommendation. So for personal statement, start it early, okay? Do not wait until you're halfway through your 3rd year to start it, because then you're gonna be like, oh, I can do it halfway through my 3rd year, and then it's summertime, and then it's August, September, and you're like, oh, great. Applications open up in September for the ERAS, and I'm applying for residency, and I haven't even put together my personal statement yet. Let alone have had anybody review it. So start your personal statement now. You can talk about club stuff that you did on the island. So I want to do pediatrics, and I went to like every health fair on the island for pediatrics. So like I got to talk about that in my personal statement. So you really want to write everything down that you can think of that's going to explain the concept of why you want to go into the residency program you're doing, why you fit there, experience that helps show that you fit there and that you utilize skills that are going to add to this residency program. All those important questions about why you fit at this hospital and why you fit in this residency type, like pediatrics, for example. So that's all the stuff that a personal statement is. And then you want to make it like a story, make it entertaining, capture the audience in the beginning, right? But capture it on the basis of something that shows your opening eye moment to this like residency that you're applying for. For example, I talked about when I was a very small kid, I remembered going to my pediatrician every single time. I was very nervous about it at first, but I always felt very comfortable coming out of that office because my pediatrician was so caring. And I remember everything about it. He wanted me to get better so I can enjoy my childhood. So like that's what I sort of talked about. And then I talked about how that lesson and that care that I saw from him really sparked my interest in wanting to do the same for kids in the future. So I talked about that. I showed different examples of how I worked with kids, did health fair and stuff like that later on in the statement. But really make a nice, well-rounded picture, and at the end, close it off. And you can actually circle right back to your story and saying, like, now that you've seen my experience and my work and how I would best fit for this and proof that I would fit for this residency program, now I'm able to do that goal or to do that thing like I had experienced in the past, or what I saw when my eyes opened to this residency program. My best friend, or my great friend, he wrote about family medicine similar to that aspect. He broke his arm and he was in like a foreign country and stuff, and there wasn't a lot of care, but he saw this one doctor really step up to the plate to help him when they couldn't afford it. Certain like those sorts of stories draw you in as to why you saw that this is a very interesting path that you want to take down residency. There's a great format on the OCG website that goes down the breakup of kind of what the paragraph objectives are sort of at. So once you type everything, I get it all out on like 5 pages of stuff, you can kind of get it cut down and make sure you're hitting like at least the big objectives of a personal statement that the OCG is kind of mentioned. Make sure you're telling you why you fit at this residency type and the place that you're applying to. And then about yourself and proof of why you fit there, experience of why you want to, what you want to do, your goals, what you could add to that program and what you could get from that program. Those sorts of things all tie into a personal statement. And so following their guidelines kind of help emphasize like, hey, make sure at least somewhere in this essay that you talk about this objective or something. So I would highly recommend it. They have a great format for that to follow. CV. So a CV is pretty much a resume of everything you've done from beginning college through. I would recommend not listening to the advice of you should only write down only medical relevant jobs that you've done. But for example, like me, I only had like 2 very small medically related jobs, where the other ones I was doing like a bunch of other things. And so there's this huge 4-year gap of me doing non-medical jobs. And if I just deleted all those, it would look like I did nothing in college. And that shows that I'm not well-rounded and have 0 experience on anything. So why would I do that? So if you do have non-medical things, make sure to include them and explain them. And again, OCG is a great format for your CV. This is actually, I've talked to a lot of 4th years that went in for their residency interviews, and all the interviewers were like, wow, this is a great format of a CV. It looks great. It's very flashy. It has all the information I'm looking for. It's very organized. It's very, very nice format. I like it. It explains a little bit about what experience you have, also tells about like what you did, like extracurricular stuff, and then things you like, right? They all have that kind of interest things, like hobbies and stuff like that. So they really do like the format that our school provides. So that's a great kind of starting point when you're going to type that up. And I just kind of copied over my resume from prior to medical school. Some of the sections I just kind of put in there, made them look a little bit flashier to make that CV look nice. Okay, let's talk about other rotations. If anyone has questions, go ahead and pop those up. I know it takes a little bit long to type them. But as far as other rotations, so Recommendations for surgery: do the same thing that I talked about with internal medicine. Try to fit it in, do the organization of the surgery. There's the OME. As far as a reading resource for surgery, I would recommend using the files of Online Med. Some people recommend the book called Pestañas. I feel like Pestañas is identical to Online Med. There's really zero new from that, so I just used Online Med and I didn't use Pestañas. I heard that Pestañas little questions that they have, you can add that. If you just have a PDF, that's free, and you can just go through the like really rapid fire questions, that like really short ones, like someone comes in with rigidity in the abdomen, what do you do? Surgery, XLAP. So like it has some good, really fast, short practice questions, sort of like BRS Physio was back in year 1. So that would be something I would recommend, is having your Pestañas just for the question thing, but really if you do all of OME, it's going to cover everything in the book of Pestañas. There's no difference between those two. And then obviously your UWorld, an additional question resource I would highly recommend, and this is why I emphasize, start UWorld a little bit earlier in your surgery rotation because you're so busy. It's not going to be bad as IM. It's okay to start IM like a weekend or so. But for surgery, I would start pretty much the first week, start doing something in there in your UWorld to cover that. There's not that many questions. I think they just added like 100 questions. So there's like maybe 300 something total on UWorld. But I would recommend getting your hands on the pre-test surgical rotation book. That is excellent. There's like 400 or 500 questions. The file, I'll see if I can post that up on my CK Med page. And that has an interactive thing where, you have the question, and actually if you click on the question number, it actually jumps right to the answer, so you can not have to waste so much time scrolling on the PDF of that. It's really annoying to do that. So pre-test surgery, very good. I found it excellent because UWorld emphasizes emergency surgery and then routine basic surgery, but it doesn't cover the aspects of anesthesiology, pulmonology, so those certain kind of like underlying things in the surgical field that you should know about, electrolytes and all that stuff. And that's where the pre-test came in, asking those questions, and it was great. I felt that really helped me for that shelf to do all those questions, UWorld and your pre-test. So that's my recommendation for your surgery, and make sure you're studying for that. Make sure if you're doing nothing, just sitting around, do something, or ask if it's at the end, near the end of the day, ask if you can go so you can study. You guys are in charge of your studying and your time to learn. We actually have a protected like 30% of the day time to study for each of your rotations every day. Some rotations just steal that from you and they give you like 5%, like my surgery was in Stockton. It was like barely any study time. It's terrible, but so really make the most out of your available time to be able to study. For rotations like psychiatry, so psychiatry is super chill. I only worked like 8 to noon on mine. Some people, they work like 8 to 3 or 4 or something. Again, this is a rotation where not always will you actually be able to talk with the patients or interview the patients, and that's a struggle because you don't get that practice of psychologically analyzing or figuring out what's going on with the patient. And that's a struggle on CS exam for students a lot, is the psych questions. My hardest case was an adjustment disorder, sort of, or similar to that sort of disorder. And it was very difficult because I didn't get a history in psychiatry. We just kind of stood there and, read already intake papers, and then that was it. We didn't do anything. So if you can ask questions, if you can ask to go in the entry point of the psych ward or hospital intake area to see if you can do some histories or observe that done, that might help your ability on CS to perform better on the psych things, and it might help you learn stuff for psych. Pretty much UWorld and OME. You really don't need anything beyond that point to do well. Emphasize, you can also review neuro at this time. Neuro is a good thing to talk about, like the different nuclei in the brain that are controlling in different diseases. Also, maybe recommend like learning the different nuclei in the brainstem that are important for autonomic dysfunction, because drugs can mess those up as well. Nucleus, basalis of Meynert, and all those little things. Just know those guys to not be thrown off by the neuro questions that show up on psych. And then an additional thing would be endocrine and how that ties into your psychiatry as well. So maybe going back and reviewing neuro section in your medicine, online med ed, and reviewing your endocrine section. And then thinking of psychological endocrine disorders, which really aren't that many, except for like when a tumor grows in the brain, or when you have like hypothyroidism. Those sorts of things can mess up neurological function, depression, sort of stuff like that. So think about that as additional subjects to add to your psychiatry to make sure you at least get a couple points if they show up on your shelf exam. For family medicine, I would recommend going to the base family medicine website, which is, you can Google USPSTF, USPSTF A and B recommendations. And these are all the recommendations for screenings in ambulatory. You have a 65-year-old man that smoked for 10 years. What do? You do an abdominal ultrasound one time to check for a AAA. There's those screening guidelines that you do for diabetes and all that stuff. So knowing those screenings, that's what shows up a lot on the family medicine shelf. You'll probably get about 20, 30 questions on family medicine that show up just on that screening, everything. Then the rest is going to be, how is outpatient managed for OB? How is outpatient managed for peds? How is outpatient managed for internal medicine, but on an outpatient basis? Those sorts of things kind of come up. And then basic underlying diseases like how does heart failure work? How do pulmonary diseases work? Big high yield things that show up that you can see in an outpatient setting. That's going to be your family medicine stuff. And then management of medications, right? If you have a really old person with orthostatic hypotension and they have syncope, what do you do? Well, you find the med that's doing that and take them off of it. So like managing meds for old people, that's a great thing that family medicine also asks about. For OBGYN is another rotation that is great to get you that experience of working with women's health. It's very interesting. I don't want to do that, but it was great to learn how to ask like particular questions of women's health that you don't really get that practice except for on your OSCEs or in your ICM or CPD courses, where everyone was super awkward of how to ask questions. And then when you go in for a pelvic exam, like, what do you say to the patient? What do you do so that you don't make her super uncomfortable? Those sorts of things. That's where your OB-GYN is going to kind of teach you that. Also, you're going to learn how to catch some babies, which is awesome, and do the process of delivery, and as well as managing pregnant women, right? Their dates and their screening tests and stuff like that. And that's where OB is a great rotation to learn all that. And then a lot of students actually that weren't considering OB actually did love it and end up, I've met a lot of people, everyone that I met that wants to do OB, they weren't thinking of it at first until they did it and they really liked it. So as far as resources, again, OME, also for family med, OME is all of medicine sections that you would do again for family medicine, because there's no family medicine section. And yeah, so that's my recommendation there. And you would start your UWALD doing some of the big sections like cardiovascular, endocrine, infectious disease. That's something you would see mainly that to show up from the medicine UWALD questions for your family medicine shelf. And then OB-GYN, yeah, OME, and reading your memorying again, memorying for everything would also come handy here as well. But remember, every rotation, you got to make those connections. So if you're an OB doctor, where would you make a connection elsewhere, right? And for example, you're in labor delivery on OB, and you come in with this woman that has intrauterine growth restriction, so a very small baby. Obviously, once you deliver this baby, you're going to be calling pediatrics to come over and check this baby out. They're probably going to be taken to the PICU just to monitor and make sure that they're doing okay, and that they're breathing okay and their heart is functioning okay. So that's where you contract and be thinking of all those OB-related baby diseases that come up, because OB and babies, they come together. That's what it is. So just think about that when you're hooking OB and pediatrics together. And for peds itself, this is my favorite. If you have the ability to go to Miami Children's, like the most bomb rotation ever, it was amazing. The education was amazing, and it was really centered around like the students. It was great. Like I couldn't recommend going there more. It was so awesome. But studying for that, the big things you got to learn are developmental milestones. Not only how to, if someone says it's a 9-month-old, how do you recognize their milestones, right, that you should be checking? But if someone comes in with these milestones, what age should they be? Vice versa. So knowing those certain things, there is a website that's called like Peds Neuro, something like that. I will post that on my CK Med page on Facebook as well. And so you guys can have access to that if you start pediatrics soon or something like that. And so it goes through, it has like this PowerPoint thing, interactive one, where you can click like, they're 9 months old or they're 6 months old. So it's sort of like questions, interactive. And they have little picture diagrams with these cute little kids showing like the different stages of what they're doing. One standing up next to the table, and it's like, oh, that's a 9-month-old and stuff. So it shows you picture form of the milestones, and then you get to go and practice that with the babies on the floor and the kids that come into the office and stuff like that. It's great. You get to see and ask those questions to the parents. It gets super exciting, and you can play with like their little feet and their legs and stuff like that. They're so cute. So that's something to also think about, is learning your milestones, learning how to do your physical exam on babies, because we only had dolls on the island. So you don't really get to practice that unless you got a baby at home. So learning how to do that is great, because those come up on questions. Like, how would you check for hip dystocia and stuff like that, and dysplasia. So like different things for the physical exams. If you get to practice those, it'll help your learning. Other things for pediatrics are knowing OB to peds pathologies. So when a baby comes in, that's a very large baby, right? What's the problem? That's the hyperglycemia in the mom. She's probably gestational diabetes versus a little tiny baby with growth restriction. Either the mom was smoking, either the mom was doing drugs, or the mom had diabetes before she was pregnant. So all these things, like, you got to think of why baby comes out this way, because you're now the person that sees the baby and dealing with the baby. What do you got to do? Then the last, obviously, vaccines. Like pretty much comes into one of the most important things in pediatrics is knowing your vaccine schedule, and then knowing it isn't until you finish your vaccine schedule that you are protected from that thing. So if you're halfway through the schedule, you're still susceptible to that infection. Don't fall for those questions when they come up. But pediatrics, great rotations. Most of the people that I know that have had their pediatric rotation really enjoyed the learning. Even if they didn't like kids that much, they enjoyed learning the material. They thought it was very useful for them. In addition, gave them just a little tools in case they have a peds patient to work with, that they'd feel a little bit more comfortable working with them. So that's kind of your peds. Again, online med ed, super helpful. Memring's helpful for this, and UWorld's gonna kill that for it. You can also do pre-test for pediatrics as well if you have the time. I did that too. I thought it was really great for peds, because there's a bunch of little tricks in there for those guys. But that's pretty much the other rotations. As far as the last thing is your letters of recommendation, I'll go after that. If anyone else has any additional questions, go ahead and type those up. I'll wait like 1 minute for those. And then I'll discuss the last 2 minutes how to ask for letters of recommendation. Okay, I guess nobody has questions. I guess I'm answering most people's questions. Okay, so last thing, all right, you got to be starting to think of this at the beginning of your rotations, but it's okay. Sometimes through third year, you don't get letters of recommendation. Sometimes they just come in the beginning of fourth year, but that's okay. If you find that you have a good rapport with a attending physician, they don't have to be an attending that rounds with you. They can be an attending that manages the department that you turn in your write-ups to, for example. So in San Joaquin and Stockton, in internal medicine, we had all our attending physicians that we'd round with, and we'd present our cases, and they'd see how we interact with the team and with our patients and do our presentations and stuff like that. But we also had a physician that he worked in palliative care somewhere else, but he would come on Mondays and give us lectures on EKGs and stuff like that. And we would be turning in our patient write-ups, all like 8 of them, to him, and he would read them. So that's a physician that is seeing your work and is seeing your interaction in a session where you're asking questions and stuff like that. So that's also somebody you can ask for a recommendation. And so when you go to ask for letters of recommendation, obviously you should have a pretty good feeling that this person would write a letter for you, but not just write a letter for you, because guess what? You can ask them for a letter and they write a crappy letter for you. So make sure to emphasize this when you go to them. Explain what you think that they've seen from you. So, you've seen my work, you've seen my write-ups, my thought process in my write-ups, like my discussion sections and stuff like that. You've seen like kind of how I've researched that. You've seen my work ethic. You've seen how I present patients on the floor. You see how I interact with the team and interact with the patients. As whatever it is that they've seen you and observed you or read your stuff, your work on, make sure that you're kind of emphasizing like, have you seen that? You're sort of asking them, right? I know you've seen that, but then you ask them, would you be able to write me a great letter of recommendation? Emphasize great or like strong letter of recommendation, right? You don't just ask, will you write me a letter of recommendation? Because, most doctors would be like, sure, we have a template, we just send it in and it's okay. But would you be able to write me a great letter of recommendation? You don't want any bad letters of recommendation or just like a okay one. You want a great letters of recommendation. So make sure that when you're asking that, it's putting at the option of them being able to answer saying like, you know what, I have seen your work ethic and I've seen you work with a team and you are great. You have a great thought process. You've thought of differentials. You explain why you would do these things. We tweaked a little bit. It's okay. You're learning very strong. You're working with us fantastically. I would be able to write you a great or a strong letter of recommendation. That's what you want them to say. And that's when you have a letter of recommendation. So that's how you do that. Usually at the end of the rotation, that's when you go to ask them for that. Sometimes the physicians want you to come back and meet them, and bring your CV and bring your personal statement if you have it or something, and they can get to know you a little bit more. They can ask you questions, tell me about yourself, know how to answer those questions too. If you're asking for a letter of recommendation, know how to describe yourself and how you would be great at this, whatever it is, But then, the question I've gotten from a few people is, okay, I want to do pediatrics. So I want 2 letters of recommendation for pediatrics. That's easy, right? I want to do that. I know I'm going to work really hard there. They're going to see that. And it's easy to get those letters of recommendation. But what about the other ones, right? Like the other 1 or 2, what do I get? So it kind of depends. So I'm getting one from an OB doctor. I felt like my outpatient was really great. I got to work with the mothers and the babies. I think that's it's a great letter of recommendation that I'm getting, or a strong one that I'm getting from this doctor. And so I just thought, okay, well, this makes sense where the medicines are combined together, OB and pediatrics, but also that I felt we had a strong relationship. And then he also was one that I went to with my personal statement and my CV. And so he's read all that. He got to know me. But if he didn't, I would bring those, or I would describe those things to him so that he would know me better and be able to write me a better letter of recommendation. Now, knowing that he's an OB, I didn't say write me an OB letter of recommendation. He knows I want to do peds. So I asked him, would you be able to write a great or a strong letter of recommendation that is that I would be a strong physician, or I would be a strong team no matter what practice I would go to, or even tailor it towards pediatrics. I've observed him on OB and how he worked with mothers and babies, and he understood how these both interacted. And I feel that his thought process in working with both of these patient populations is very strong and whatever. So you can ask them, can you write me a general letter of recommendation that I would be a strong physician, or can you write me a great or strong letter of recommendation for this particular field, because that's the one you want to go into. So when I ask my pediatric doctor, I'm going to say like for pediatrics specifically. So make sure to kind of tailor that question appropriately for them. And then you can always ask them if they don't know that much about you, or if they haven't read your personal statement or your CV, you can always ask them, would you like to know me? Get to know me more? Would you like to meet with me? We can discuss that. Do you have any questions that you would like to know about me? Those certain things obviously engage you in conversation with them, but help them to make a proper and strong letter of recommendation for you. So that is my recommendation, to get letters of recommendation. So if anyone has any last questions, go ahead and type those up. I'll give 1 minute before we kind of close out, okay? Okay, I guess nobody has questions. So that pretty much closes off our section. If anyone else has additional questions, make sure to message on my CK Med Facebook page, and I can answer those appropriately. And if you have personal questions specifically, feel free to message me on Facebook as well, and I'd be more than happy to help answer those for you. Or else, for now, I will say farewell until our next session. All right, bye.